Hi, my name is Kevin, and I work for Center of Balance. We are acupuncturists and Chinese herbalists based in Dinsdale, Hamilton, and we also have a center in Auckland, Remuera area. So if you know anybody or if you yourself need any treatments, we'll be more than happy to help you. We also provide ACC treatment. And some of the conditions that we treat is, for example, lower back pain, shoulder pain, knee pain, any chronic pain or acute pain we can treat. We can also treat some, internal symptoms such as stomach problems, headache, infertility, eye problems, and these are our specialties. We can use acupuncture or use herbal medicine to help you. If you haven't tried needle before, a little bit scared of needles, don't worry, we can also offer other types of treatments. We can use cupping, massage, moxa. There's lots and lots of different things that we can use to help you. So I'm doing a live talk today on the topic of knee pain, continuing from where I left off yesterday. And actually, I've done some talks on knee pain in previous weeks as well. So today, I'm mainly going to focus my talk on treatment and prevention of knee pain. So I will start by talking about knee pain treatment from Western medicine's perspective. Then I will go into Chinese medicine's perspective on knee pain. So let us begin. So treatment for acute knee pain means sudden. It comes on suddenly, maybe due to injury or maybe due to some other issues. It could be related to your organs as well. For example, your gallbladder can also trigger knee pain. For example. Okay, so let's go on. So for fractures and broken bones in your knee will need to be assessed by a healthcare provider. You may need a cast or a splint to stabilize the knee while the bone heals. In the case of more severe fractures, you may need surgery, followed by a splint and physical therapy. Hello there, hi. Welcome to the channel. I'm doing a live talk on knee pain, and my name is Kevin. I'm from Center of Balance. So I'm just doing a Western medicine's perspective on knee pain. So at the moment, I'm covering treatment for tendinitis, or runner's knee, or gout and bursitis. So the treatment for conditions that causes swelling, redness, or dull burning pain usually starts with resting the joint first. Ice your knees to control the swelling, elevate and stay off your joint to promote healing. And your doctor may recommend or prescribe some over-the-counter medicines such as ibuprofen. Lifestyle changes such as wearing protective knee pads and going to physical therapy can help you manage pain and experience fewer symptoms as well. Excuse me there. You may need to make changes to your diet, especially if you are treating gout. For ligament, cartilage, and joint tears. Ligament, cartilage, and joint tears in your knee will need to be addressed by your doctors. After imaging diagnostics and the clinical assessment, your doctor will let you know if your treatment will include physical therapy and anti-inflammatory medication, or if you need to undergo surgery to repair the injury. So recover from knee surgery can take some time. It may take anywhere from 6 months to a year to resume to your normal activity. This is because the knee joint is actually very active, can move. So if you operate on the knee, it will take longer to heal. For treatment for osteoarthritis, or known as OA. So OA is a chronic condition. While it can't be cured, you can manage its symptoms. Treatment options for osteoarthritis may include one or more of the following. Using over-the-counter drugs or other pain medications. You can also go for physiotherapy, assistive devices such like a knee brace, or treatment with a TENS unit. So TENS it's known as TENS. It's a type of electro stimulation pad, and that can be put around your knees, and then it will send out electrical pulses to stimulate your muscles and making the contract, and hence making the muscles stronger in that area. Also, changing your diet, losing excessive weight, and quitting smoking can also have a positive impact on managing symptoms of osteoarthritis. Corticosteroid injections are also a possibility for managing pain in your knee from arthritis. In some cases, a total knee replacement is recommended as the definitive treatment for OA in your knees. If you need help, connect with your primary care doctor. You can also browse for doctors in your area through a Google search. And then we have, let's go on to treatment for chronic knee pain. So for chronic knee pain, each underlying cause of chronic knee pain has a specific type of treatment. These treatments may include physical therapy, medication, surgery, and injections. Bursitis, a common cause of knee pain, is treated in the following ways. So bursa is like a fluid sac that sits behind the kneecap. Behind the kneecap, that protects your joint when it's moving from grinding with each other. If there's no bursa, then the joint will be contacting with each other and causes friction and damage to the joints. So bursitis is the inflammation of the bursa sacs. Okay. So how do you treat bursitis? So firstly, ice the knee for 15 minutes once an hour for 3 to 4 hours. Do not apply the ice directly to the knee. Instead, cover your knee with a cotton towel. Place ice in a plastic zip closed bag and then place the bag on the towel. Wear cushioned flat shoes that support your feet and don't exacerbate your pain. Avoid sleeping on your side. Use pillows positioned on either side of your body to prevent you from rolling onto your sides. When lying on your side, keep a pillow between your knees. Stay seated when possible. If you have to stand, avoid hard surface and keep your weight equally divided on both legs. So, and then the last advice is to lose weight if you are overweight or obese. So next, I want to talk about how do you prevent chronic knee pain or acute knee pain? So you can prevent some, but not all of the possible causes of knee pain, but you can't prevent chronic knee pain. there are things you can do to alleviate the pain. You can, if your knee pain gets worse because of overuse or tends to be the most painful after physical activity, you can make lifestyle changes to help treat the pain. And I'm going to give you some advices. So the Western medicine's way of preventing the knee pain is actually also quite effective. So listen carefully on these advices. So firstly, to prevent knee pain, warm up before you exercise. So before you start any exercise, warm up and then do stretches. If you stretch muscles in the front and back of your thighs, it decreases the tension on your tendons, ultimately relieving pressure on the knees. And then the next advice is to try low impact exercises. Instead of tennis or running, give swimming or biking a shot, or mix low impact exercises with high impact exercises to give your knee a break. Okay. At the gym, you can try rowing machine or cross-country skiing machine. Both offer a strong workout with low impact on your knees. And if you don't want to spend time in the gym, you can try swimming or walking. They are also really good for taking the pressure, but also still give you that cardiovascular exercise that you need. Okay. The next one is walking down hills. Running puts extra force on your knee. Instead of running down an incline, you can try walking. Okay. Now, and then the next one to prevent the knee pain is stick to paved surface. So rough roads or pocketed walkways may be hazardous to your knee health. Stick to a smooth paved surface like a track or walking arena. And then get support. Your shoe inserts can help treat foot or gait problems that may be contributing to the knee pain. Replace your running shoes frequently to ensure they still have proper support and cushioning. And also, wearing correct shoes will help you to maintain proper leg alignment and balance, and ultimately preventing knee injuries. Excuse me there. They will also feel a lot better in the long run and provide support for your knee and ankles. And weight training. Weight training to strengthen your leg muscles to better support your knee and avoid injury by working out with weights. Be sure to consult with your expert, with the gym, the gym trainers or experts first, to learn the right way of lifting and prevent any further damages. And one really important point is when you have knee pain, don't decrease your activity, okay? Whatever you're doing, don't say, okay, because my knee pain is there, I'm going to rest, okay? Because a decrease in your activity will lead to weakness in the muscle and ligaments and joints, and increase your chance of injuries because your knee is not being held up or protected by these important muscle groups. So build up gradually to avoid knee pain. And then the last but not least, if you already have a knee injury, please visit a doctor or physiotherapist who can help you set up an appropriate exercise regime. Some people with joint issues wrap their knees during physical activity. This is done because it feels good, and as long as the wrap is not too tight, it can help support the joint. Now, let's have a look at the traditional Chinese medicine's perspective on knee pain. So I may have mentioned in our previous live episodes that to understand knee pain from a Chinese medicine's perspective, we first need to understand the meridians that runs through the knees. Okay, so there are actually three meridians on the outside surface, including the back. So these are the stomach that runs through the knee, gallbladder runs on the side of the knee, and bladder meridian that runs at the back of the knee. Okay, and then you have the three yin meridian, which are on the inside. The kidney meridian runs on the inside, and the spleen meridian also running on the inside, and liver meridian that runs on the inner side of the thigh as well. So these are all covering the inner side of the knee. So if any of these meridians get stuck or get blocked or have problems, then you will experience pain. So there are two types of pains. One is what we call a qi stagnation and blood stasis. And this is usually caused by injury. So if you injured your knee or the meridians around the knee, then that area will not be able to flow properly. For example, if you're experiencing knee pain here, at the front of the knee, after physical activity, that may be because something you did during the exercise may have injured the meridian and stop the qi, which is the energy and blood, from flowing up. And as it's like a kinked hose, if the hose is kinked, then the energy, the water's trying to get through, it cannot get through efficiently, then the pain start to swell, pains to start to occur, and swelling start to occur as well. The other type of pain is when you are when there's some trouble in the meridian. It may not be due to injury, physical injury. It may be because of chronic condition that you're suffering. Okay, that the meridian itself start to become deficient or weak. That means not enough energy is running through the meridian. Okay, deficiency. So imagine you have a hose, okay, a watering hose, and then you're not turning up the water volume enough, so the water doesn't actually flow out. So that is one cause of, energy or qi or blood not being able to travel effectively through. And when things don't travel along the meridian, then pain start to occur. So in traditional Chinese medicine, we say when there's pain, there's blockage. And when there's no blockage, there's no pain. Okay, do you get it? So two types. One is due to injury, blocked meridian. The other type is deficiency, not enough energy to push through, deficiency of the meridian, okay, and causing pain. So usually usually a deficiency type of pain is dull, like a dull ache, and that is persistent and long, chronic in nature. So it may be, it takes, it's been there, the pain has been there for many months or even years or even decades. The acute type of pain or due to blockages is usually sharp, okay? Sharp pain that comes on suddenly, or strong pain, sharp, strong, like stabbing pain. These are due to blockages, blood stagnation, blood and qi stagnation, okay? So that's how you tell the difference. Okay, so now you have an understanding of the Chinese medicine's perspective on knee pain. I'm going to give you some points for you to help you to prevent knee pain at home by yourself. So the first point I want to teach you is Wei Zhong. This point is called Wei Zhong. Weizhong is actually situated behind the knee. If you use your hand to palpate, to feel your knee behind the knee, you can feel actually there's a tendon here and there's a tendon there. They're quite strong tendons, so you can actually feel them quite well. They're quite pronounced. Weizhong is actually in between the two tendons and just right behind the knee area. And that point, if you don't have any problems there in the knee, then you shouldn't really be feeling any pain. But if you can feel pain there and tenderness there when you're trying to dig it or massage it, then that means that you potentially have some knee problem, even if you don't feel knee pain. And so you can massage that point regularly to help deal with, prevent knee pain or manage your knee pain when you have one. Thank you very much for giving the thumb up. And the next point I want to show you is a point under the knee. Inside, okay. It's actually on the outside. Okay, so I'll stand up and show you. So this is your knee, all right? Now, imagine you're taking your hand and putting your palm on the kneecap. Okay, you're putting the center of your palm on the kneecap. Then the thumb, where the thumb lands on the side of the knee, that is a good point for treating knee pain as well. It can help increase the energy circulation and blood circulation in the joint area, particularly on the kneecap. If you have pain on the kneecap, this is an excellent point to massage. And then the other point is actually, if you use the other hand, put it on your knee, that point there is also a point. See, it's about a thumb's width. A thumb's length. And also here, a thumb's length. So these 2 points, if you have a knee pain here, there should be some pain areas, some pain points on this, along this line. Okay, so you can use a massage tool, or you can just, use your knuckle to give it a good massage. And once you find the pain point, okay, just give it a good massage. And do that regularly. It can also help you with your knee pain, especially on the kneecap area. Now, the next point is called Yang Quan. Yang Quan is actually on the side of your knee, okay? On the external side of your knee, the lateral side of your knee. So this is the kneecap, okay? So if you trace down the kneecap about, let's say, about 3 fingers width, okay, down here. Then you draw in. You should be able to feel a bone here. It actually comes out quite hard, okay? A bony point here, a bone here. This is actually called the head of the fibula, okay? So Yang Quan is actually under the fibula and forward, and about half cun or half inch under and in front of the fibula. Okay, so this point, if you give it a good massage, can also help increase the qi and blood flow in the leg, especially in the knee area. So this is a really good point to massage. Last point I want to give you to help you prevent knee pain, you can use that. Okay, so this point is also on the outside of the knee. Okay, this point is, you find your kneecap, and at the base of the kneecap, put about 4 fingers width under your kneecap. And it's about a thumb's width outside of your shin bone. Okay, so it's roughly around here. This point is called 足三里. 足三里 is really good for any issues along the stomach meridian. So if you have any pain in the knee area, this is also a good point to massage. Even if you don't have knee pain, it's still good to use this point to help you maintain a good knee health. Okay, so you find this point, give it a good rub for about 30 seconds to a minute, and then you can do that multiple times a day. Okay, and this will help you prevent or alleviate knee pain. Okay, and lastly but not the least, you can use warm compress or heat pack on your knee when you have knee pain. That is going to help you alleviate your knee pain for sure. Okay, so thank you very much for watching. So the advice I give you, the advice from Western medicine and Chinese medicine in this episode are both really, really useful for helping you alleviate and prevent knee pain. If you try these massages at home and you still feel somehow you still can't shake the pain or can't get rid of the knee pain, then give us a call. Our number is 078467956, and or alternatively you can go on Google and search us up on just type in Center of Balance Dinsdale or Center of Balance Auckland Remuera, and you should be able to find us. All right, this is the end of the episode for today, and I hope you benefit from this this live talk. And if you have any questions, please don't hesitate to leave a comment down there, and we'll be more than happy to answer. Alternatively, just give us a call. We'll be more than happy to give you to chat with you about your problems, or we would like to invite you to come in for a face-to-face consultation. All right. See you next time. Bye.